News on the coronavirus vaccine that Canada is expected to approve this week and is getting ready to distribute. British health officials are putting out a warning about the Pfizer vaccine and potential allergic reactions. The warning is not stopping the UK from using the Pfizer vaccine this morning. This is the second day of its mass vaccination program, and as you can see in this new video, people are still getting the shot. Health Canada could approve the Pfizer vaccine for use here within days. The provinces are already detailing their plans to start giving the shot to Canadians as soon as possible. As we reported earlier this week, federal officials, healthcare workers, the military, they are already going through practice runs to distribute it, given the intense challenges it presents in this country. We begin with Cindy Palm in London once again, live for us. She's been covering the story and, of course, live as the UK began its mass inoculations. But what is the latest detail on this breaking news of the allergic reactions, Cindy?
Well, Heather, the UK drug regulator is warning that people who have severe reactions should not get this vaccine. So if you have a significant reaction to not just vaccines, but food as well as medicine, you are advised not to take this vaccine that only started to be rolled out yesterday. The UK was the first country in this world to approve this Pfizer-BioNTech vaccine. Now, according to media reports, the two people who fell ill were medical workers. And according to a report, they had what's called an anaphylactoid reaction, which symptoms could be, for example, rashes, breathlessness, sometimes a drop in blood pressure. This is not to be confused with an anaphylaxis reaction because that is life-threatening. This is not that. We've also heard from the UK drug regulator. This is what the chief executive said. Take a listen.
From the extensive clinical trials that this wasn't a feature, but if we need to strengthen our advice, now that we've had this experience in the vulnerable populations, the groups who've been selected as a priority, we give that advice to the field immediately.
In other words, she's saying that this is not enough to stop the rollout of a vaccine. This was seen as really being a watershed moment, Heather, when it was rolled out yesterday, a light that many people have seen at what's been a very dark tunnel this year.
Cindy, there's another vaccine that Canadians could end up getting, and it too is under the lens this morning. There is peer-reviewed research suggesting the AstraZeneca and Oxford vaccine needs some work to improve its effectiveness, particularly for a particularly vulnerable part of the population. What are we learning about it today?
Well, Heather, this vaccine was seen as the front runner in the fight against the COVID-19, had a lot of potential. However, a peer-reviewed article in the medical journal, The Lancet, says there's still a lot of work to do to prove that this vaccine is effective, because what we saw during the clinical trials was that there were different rates of effectiveness depending on the dosage given. For example, people who received 2 full doses, the effectiveness there was 62%, whereas if you receive half a dose first, followed by a full dose later, that is when the effectiveness went up to 90%. And what's also noted in the Lancet is that less than 4% of people who participated in this clinical trial were over the age of 70. And very crucially as well, there was no one over the age of 55 who participated in the trial and received the 2 mixed dosages, the one in which you got the half dose first, followed by full dose, and that was the one that had a 90% effectiveness rating. Now, we did hear from the Oxford vaccine group head, and this is what he said about the fact that he believes this isn't really a race to be first. Take a listen.
The race is much more against the virus than against other developers. We're all in a race against time, because if we don't get on with it and start rolling vaccines out, we'll still continue to be in this crazy position that we're in with economies slumping and the impacts that there are directly on people's health from this virus.
And hopes have been really high for this particular vaccine because it is cheaper than the others and easier to ship. Whereas, for example, the Pfizer vaccine is tricky to handle because it does require being stored in minus 70 degrees Celsius temperatures. Heather.
Cindy, thank you very much. Cindy Palm is in London this morning.